Good evening. My name is Dr. Dmitri. How may I help you today? Okay, so you'd like just a general checkup. That's perfectly fine. It's always a good idea just to come in on regular occasions so that someone like myself can check that everything is okay for you. Can you just briefly tell me or give me any reasons why you're here today? Have you been feeling a little bit sick or a cough or any flu-like symptoms that might be persisting or anything else that might be giving you any type of discomfort? Anything that I can help you today with? Okay, I understand. So you've been feeling a little bit stiff lately and a bit of a sore neck. Okay, that's quite understandable, and it's definitely something that you can look at possibly changing some of your routines that may benefit that. Okay, is there anything else that's bothering you? Okay, so what we might do today is I might just have a little bit of a check over your body just to make sure that there's nothing that shouldn't really be there, or if I can notice anything that's not quite right that may be attributing to your discomfort. Okay, so before I begin that, I'd just like to just discuss a couple of things. So as we get a little bit older, our lifestyles tend to be a little bit more relaxed or slower. We tend not to be as active. I find myself that when I'm in the community, I observe a large number of young boys and girls from quite young ages to teenagers and young adults. And I see them using certain devices, and I notice that the posture that they use while they're engaging in devices like this seems that it may be contributing to the problems that some young people are facing. So when I was younger, young people didn't really go to chiropractors, or we didn't really have back pain or neck pain issues because there were no devices like that, really. And so we were always out and about, moving, and we didn't really suffer from these types of things. But now, like myself, as my work is not really active or anything like that, that I myself also suffer from some of this lack of movement contributing to stiffness and sore necks and things like that. So maybe we can have another appointment and I can talk to you about some of the ways that you can help yourself. What I find is that with all the different medical professions that are available today, they're like compartmentalized, where they're all individual and they're all very good in their individual knowledge, but I find that they don't really communicate, and that if they were to communicate more, they could be a little bit more effective in helping people in this regard. So in our next appointment, we'll talk about some things that you can do just to help alleviate any stiffness, neck pain or back pain that you might be experiencing, just through simple, very, very simple activities and simple things that you can do that do not cost a lot of money. Okay. All right, let's start with this checkup. So I just want you just to hold still. I'm going to have a look just around the facial area. Now, hold still. Just want to have a look at your eyes. Just hold them open. That's it. Perfect. I'm just having a look at some of these. Just at any blood vessels around the eyes. They all look normal here. Let me just check the other eye. That's it. That's it, hold still. Okay. Now what I'd like you to do is just to look at my fingers and just follow my fingers. That's it. Follow my fingers. Perfect. Go up and down. And we'll go to the side, and up, and up, and up. Are you able to see that okay? Alright, we'll go down. Alright, just look at the two fingers and go side to side, up and down. Okay, just give me a moment. I'll just grab one of these little tools. Just hold still. I'm going to have a look into your ear. That's it. I'm just looking just for any signs of redness in your ears that might indicate any form of recent or current infection. That's it. Perfect. Alright, that all looks fine. Just be one moment. That's it. Thank you for waiting. Now what I'd like you to do is just to open your mouth, just so I can use this, just to have a look at your tonsils. That's it. Open up, hold it. Alright, open up one more time. No, they all look fine. Okay. If you don't mind, I'd just like to take your blood pressure just to check that there's you're not under any stresses. How's your stress levels been lately? Alright. So you've been taking my advice and finding something just to help relax. Okay. Alright, here we go. Are you ready? Just let me know if there's any discomfort that I can help you with. Alright, very good. You seem quite relaxed. Your blood pressure is perfect. Okay. What we're going to do now is I want to listen to your heart. Okay, here we go. Okay, just relax. It's slightly elevated, but that's kind of normal in this situation. Have you been experiencing any chest pain at all? Okay. What about breathing difficulties? No. Okay. What I'll do next is I'm just going to listen to the sound of you breathing. So I'm going to do this on both sides at the front, and then I'll rotate around to the back. All right, breathe in, breathe out, breathe in, breathe out. One more time. Breathe in, breathe out. Perfect. All right, I'll just move around to the back. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Okay, so we'll just move down this side. Okay, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Okay, so I'm just going to move around to the back. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Okay. All of your breathing sounds very good. Nice, deep breaths. So just remember, just to use your breathing as a form of relaxation. Meditation is a great form of breathing exercise, and it's always something that can never hurt with anyone's routine in their lifestyle. Okay, what I'd like to do next is just to feel around the front of your body, and then I'll move around to the back, and I'd like to see if I can just notice any tightness that you may have that might be contributing to any sore backs or stiff necks. Okay, just 1 second. Alright, I'm just going to push a little bit. Let me know if there's any discomfort. Okay. I'm just going to push a little bit. Any discomfort at all? Okay, that's good. Now I'll just do some tapping to your back. Okay, I'm just going to push a little bit. Okay, yes, I can feel some of that stiffness. Okay, I'm just going to do some tapping on the back. Okay, I can definitely feel lots of muscle tightness just in around the middle and the lower back area, what I would recommend is that you make another appointment with reception, and what we can do is we can spend a little bit more time going over some of the things that I might suggest that you can try that can help alleviate any back pain, stiffness. So, there's lots of different things that are important for your own health. A healthy mind, I think, is number one, and it's important to have the tools available that you can use just to help relax. Another important tool is having the knowledge that and experience that other people have that you can use. So what I'll do in the next appointment is that I'll put together a list of people that have expertise in the areas that I'll talk about, so that I might be able to give you a reference so that you may talk to and find someone that can really help combine all of the knowledge of all the medical practitioners into a simple and easy way for you to understand it. Thank you very much.